Hello and welcome to Dental Health Matters, brought to you by the BSDHT. Today's episode is a very special one, as we're joined by Mike Wheeler, recipient of the Dr Gerald Leatherman Award, which recognises outstanding contribution to the dental hygiene and therapy profession. I'm Rhiannon Jones, President of the BSDHT, and I'm delighted to welcome Mike back. When he received the award last year, technical issues meant he wasn't able to share his full reflections. So today we have the opportunity to hear more about his remarkable career, the legacy of Dr. Gerald Leatherman, and how the profession has evolved over the decades. This conversation is about leadership, teamwork, prevention, and the quiet impact of those who shape our profession behind the scenes. So today we're joined by Mike Wheeler, a recipient of the Dr. Gerald Leatherman Award, which honours outstanding contribution to the dental hygiene and therapy profession. When Mike received the award last year, there sadly were some technical issues that meant he wasn't able to share his full reflections. So we're delighted to hear more about his journey, the meaning of the award, and his thoughts on the profession today. So Mike, thank you for being with us.
It's actually a very big pleasure. BSDHP has been part of my life for some considerable years, and BDHA before that. So it is with pleasure that I'm pleased to do this podcast today.
Oh, that's great. Thank you, Mike. Well, to start us off, how did it feel to be recognised with the Dr. Gerald Leatherman Award?
I was very surprised. It was a considerable honour to be singled out for any award in a way, but I see it as the work I've done in about bringing teams together rather than an individual award to myself. I think having been involved and laid the pathways for direct access, the autonomy of practice, and the work I'm currently doing around medicines management and those kind of areas are really key to the development. So it's with that honour that I see it not as an award to me, but largely to the people I've worked with and the teams that we support.
Oh, that's lovely and very gracious of you. So for those who may not know much about the award, could you tell us a little bit more about the Dr. Leatherman himself and why this award particularly holds such significance in the BSDHT's history?
The award itself, being named after Gerald Leatherman, is kind of symbolic of my own career to date. So Dr. Leatherman, just at the beginning of the First World War, was conscripted into the Royal Air Force. He was part of the small team that developed a pathway of training for dental hygienists, because until that time in the United Kingdom, there were no dental hygienists. There had been an early experiment in the late 1920s that was abolished. He fought the case with an idea from an eminent surgeon, Kelsey Fry, to say that prevention needs to be at the forefront of what we do. In reality, what happened is that the amount of time lost to flying because of the incidences of what we would now call acute gingivitis was so dramatic. And if you imagine working in a very small space and the smell of somebody with ANUG, because that is actually recorded, that they really need to do something. And it was as simple as getting people to educate, to get the right kind of education, to look after their own mouths in that kind of way. But I think in reality, what Gerald Leatherman did and why he was singled out to the name of the award is fought not only in the United Kingdom, but across Europe. He became very involved in the International Federation of Dentists to say that actually, when we talk about delivery, about oral health improvement, that we need to ensure that prevention is at the heart of that journey.
Well, this award is, as we know, peer nominated, which makes it very special. How did it feel to know that your colleagues had put your name forward, Mike?
I think it came as a bit of a surprise. I was asked, I was asked some years ago, in honesty, but I just finished being the president, both of BDHA and the inaugural president of BSDHT. And I felt actually they were actually better people. It had been engrossed in what I did. I'd been ingrained in everything. But it was the people who you don't normally see that I think the award should actually be aimed at. And I think at that time I was a well-known face. And therefore, it did come as a surprise when two of colleagues I actually work alongside said, actually, we're going to nominate you. But by that time, I had taken a very back role, although working realistically behind the scenes to promote the profession in the wider development, both with the GDC and within the NHS. It was a real surprise and a great honour to receive the award.
Looking back over your own career, what experiences or milestones perhaps really stand out and really shaped your contribution maybe to the profession, do you think?
I was very, very fortunate to work in a very supported environment. Even when I first qualified, in my first working week, I can remember the senior dentist at the end of the day coming into my surgery and say, is there anything you want to talk about today? We didn't have the term reflection as we do today, but he said, have you been happy? The patients were almost chosen. I mean, we had hour-long appointments because, yes,
still
exactly.
Don't have that.
So, very different. The hour-long appointments because I was new, I should say. So the first patient I ever saw, which I learned a great deal from, was actually he was an air traffic controller and he'd actually been a salesperson for Wisdom toothbrushes.
Oh, gosh.
So what I learned very quickly is that hour goes very soon.
Yeah.
The next patient actually was a navigator who'd been a dental technician.
Gosh.
So the people I worked with had almost chosen who I saw and what I was going to learn the most. And at the end of that week, what I learned the most was the importance of communication and having an empathy and understanding who that patient is as they walk in the door.
Yeah.
And I think today, and I'm really challenged that when we hear so much about so many people who see 20-minute appointments, I really don't know how they do it, and they don't understand the patient. And I think that's where you learn a great deal about not only a medical history that we would look at, but the importance of the social history and who that person is and how you relate to them.
Yeah.
And I think, moving forward, I think that's the challenge for people working in any kind of environment when you're under pressure just to see more patients. In later life, when I worked in general dental practice, I had a famous job on a Saturday morning, very challenging job, because my job on a Saturday morning was to buy cakes for everybody before we turned out for work.
Very important.
We had a dentist who is immediately post-foundation year who said, why is it the patients all like seeing you? And the practice owner said, go and sit with Mike. And I said, but I don't know what to do. I don't know what to do. I just communicate. So going back to my first point is that understanding of the patient is what becomes so important.
Yes.
And so as a clinician, I think we quite often lose sight of that. When it was time for me to leave the RAF, I developed a motor nerve problem. Luckily, I was lucky because I was the first and last actual dental hygienist to receive an RAF scholarship to go to university. That led me down an education and a public health route because the two things were combined. And therefore, when I was leaving, I was looking for a job, not full-time in general practice. And everybody said, you must be mad. That's like no money. But there is more to life than money. That's what people don't realise. And actually, to be honest, those who are thinking about their health, about how they're supported in a job, about their future when you consider about a pension, and about how you work in a team, actually, the NHS offers that.
Yes.
So look more than the pay. The pay now is actually not bad. I mean, it is never going to keep pace with general dental practice. No. But you will be supported. There are opportunities for escalation. There are opportunities to step outside of your prime role into other, because I don't think people realise, and certainly talking to a lot of new young dental hygienists and dental therapists, they very quickly realise the toll physically and mentally it can have working in a very, very busy dental practice. While the NHS offer is very different, because you will be supported and it will open doors for the future, as I'll go on to. And
sharing your story, your pathway being different is inspiring for other people. Sometimes you have to find your own path.
That's exactly it. Yeah. No, but I mean, in the kind of work I do now within the NHS, there's a lot about career development. And people say, well, it's quite limiting. If you become a dental hygienist or a dental therapist, that's it. You're in but actually not. there are many opportunities, but you've got to be prepared to step out the box. You may need to step down and you may need to step across in pay wise, but those opportunities are there for the taking. But you really need to think differently. But you've got to start thinking very early on about what you want to do.
A bit more of a strategy.
Yes.
Yeah. So you've witnessed the profession evolve considerably. You've seen some positive changes that you've already talked about, but where do you think dental hygienists and dental therapists have perhaps made the most progress?
I think it's now the recognition of their role in the dental team. And in part, that's not come from within healthcare. That has come from the general public. So for those of you who are old enough to remember the days of the Yellow Pages, which is the modern day website, so I haven't got old, that actually no dental practice today would even consider opening unless they've got a dental hygienist or a dental therapist. And I think that in itself is driven by patient demand, but more importantly, an understanding by patients the way that they themselves value their own oral health. I think the single biggest challenge is, sadly, it means it can be driven by the pound note in somebody's pocket. And I think, and what I would like to see more of, is to people step into roles within the NHS, and that may not just be a salaried service or a hospital, the community and social enterprises that now exist, where at least for part of their week, they're really looking after and providing care to those people that are challenged to get care. And that might be a low income or no income. It might be because of substance misuse. It might be because they've got some kind of level of systemic disease or some kind of additional need, and we shouldn't measure those needs. All too often in healthcare, we kind of want to put people in boxes. But actually, when we think about the kind of commissioning strategy the NHS is now taking, the fact that one of the key drivers is about ensuring that there's a greater emphasis on prevention and moving people out of hospital, the more we can do as a team to help support that is vital. And we're already beginning to talk now, particularly within salary dental services, to say we need to create opportunities because where they cannot recruit people, those kind of posts get lost from the establishment. They lose the money, directors of finance will say, well, you've been advertising that post for 3 years. Sadly, this is a true story, but you've never recruited. So you're not going to have one. We're just going to take the money. But we need to do more to put that money back. But more importantly, to make sure that across the spectrum, whether you're newly qualified, you're in dental school at the moment, or you're considering your career options, because after 10 or 12 years in general practice, you can genuinely burnt out and you might want to do something different. So consider a role. There was a lot of challenges during COVID about people not being paid. But actually, if you stepped into a role in the NHS, it provides an opportunity for progression. It puts you into the defined pension scheme. More importantly, it puts you into a very strong team to work with. But more importantly, it will ensure that you're providing care, remembering that whenever you trained, and if you trained in the last 50 years in the United Kingdom, the NHS actually paid the lion's share of your fees. And that's what a lot of people forget. It actually costs between £20,000 to £30,000 a year to train a dental hygienist or a dental therapist, considerably more to train a dentist. But that is all government funded. Even when fees were introduced, that is still less than 25% of the true cost.
Yes. And
so, think differently, but I think the profession is going to grow. Yesterday, I was involved in discussions around neighbourhood health centres, how oral health can be involved in that. And that in itself is going to be driven by the need for prevention rather than active treatment. So when you're considering your options, is to think carefully, but to keep abreast about what's happening in the future. That's what's important.
Yeah, thank you, Mike. That's really interesting. And And I think it's encouraging for us because we need that inspiration. Like as you say, it's easy to be siloed into practice and think that's the only way. There are so many different ways. And as you've said, people fall into them, but they were looking. They were some sort of cycle of change that they were in. Thank you. So I like to be positive. I'm a positive person, but I'm also a realist. There are challenges in our profession. I just wonder, what do you think we could do as a collective, and particularly for a society like ours, to really help people overcome those challenges?
I think the best way is not to become entirely focused on what's happening in the developments that are company led, because they're about supporting different type of initiatives. They're very much based on aesthetics. So only this morning, somebody made a comment about dental hygienists only working in private practice. Actually, that's not a true statement. It's because there are a lot of opportunities that are no longer there. I was actually recently at a BSDHT meeting where somebody was challenged. They saw a job advertised for a dental therapist, which wasn't actually filled, and they wouldn't take a dental hygienist. But that's because they didn't understand the true value of a dental hygienist. Yeah. And they, having spoken to the people now, they kind of regret that decision. So it's about making the opportunities, but making sure that BSDHT works to promote care and ensure that we are balanced around the patients that we treat, that we think equally about aesthetics, because that is changing dentistry. Or oral healthcare. I'm not sure whether aesthetics is oral healthcare in my own view, and there's probably a strong argument to be had about that. Absolutely. Because for some patients it can promote their well-being. So there is a balance. There is an absolute balance to that. But on the same time, we've got to remember that when we look at the history of healthcare, when we look at the history of oral healthcare, it was really about improving the oral health of those people that can't access care. And that in itself leads to new challenges and new opportunities. And what I hope to do in my last year probably or so in employment with the NHS is to ensure that actually we're balancing out need, that dental hygienists and dental therapists can be key parts of those teams, and that BSDHT is supportive of that, as it has been, to make sure that we're seen with balance and about providing opportunities, both not only in the private sector, but also within the wider healthcare sector.
You know, as we celebrate each other and recognise one another through honours like the Dr Gerald Leatherman Award, I'm just thinking for anyone who's listening who would be inspired to nominate a colleague, and going back to what we were talking about earlier, it's sometimes the unsung heroes as well, isn't it, who are just as eligible. But how can they go about that, Mike?
I think the most important thing is to obviously be a member of BSDHT, because any award that isn't commercially run is well recognised within the profession. But most importantly, picking up your point much earlier, Rhiannon, was about ensuring it's the people we don't normally see. One of our challenges at the moment is social media can take over, but it's the people who are not there. It's the people that are working well behind the scenes. They are giving up their time very freely to go and work with those very, very disadvantaged groups. You know, those people particularly who volunteer with some of the larger charities, both to provide care in this country, they take it abroad. It's those people, they don't seek publicity. They raise a lot of money. Some people work with individual patient groups, both within oral healthcare and the wider healthcare need. Some people have the opportunity to develop streams of work that we have never considered, but because they aren't self-publicists, to be fair, they're quietly going about making considerable change and having a considerable impact on improving people both within their community and the wider community. And I think, you know, real credit to BDHA when it introduced the award, and to now that it actually continues, and it has such a profile within the wider profession, and perhaps needs a bit more profile in the wider healthcare setting as well, to actually look and say, actually, I have a friend who does this. They go into a care home every other week. They don't get any money. They work with the homeless. You know, they go with various charities abroad. They've done it for the last 3 years. They generate their own money in their own way. They don't jump up and down about it, but they're making a considerable impact both on individuals and groups without jumping up and down about it. And I think that's the strength of the Dr. Leatherman Award, is it's a way of recognising, and particularly because it's peer driven, that individuals themselves can nominate their colleagues that become so real.
Thank you, Mike. I can see why you're a well-deserved recipient of the actual award itself. And I believe, like you do, of giving back for the training that we've received and what the opportunities that's given us. It actually can be really valuable to step outside of the normal practice. And also remembering that some people had no choice to work in a private practice. They may have been employed in an NHS practice that then went private. And we've seen a lot of that lately. So it's remembering that people often in our position don't have that choice open to us. Thank you. So finally then, what message would you like to share with the next generation of dental hygienists and dental therapists?
I'm not sure what the next generation is. I think we've seen a societal change in that people are unwilling to volunteer. People don't want to step outside the front door after 5 o'clock at night. I think we look at BSDHT now. I was recently at a very, very good regional group meeting, but there were very few people there. When I talked to my colleagues across England, even getting council, local committee members and things like that is a major challenge. It's not unique to dentistry. And in fact, because I'm now involved in a military charity, it's almost exactly the same thing, trying to get willing volunteers. I think what everybody should remember for the future is that when they were recruited into, if that's the right term, into dental school, whatever discipline you're going to follow, it's about providing care. And it's an understanding about the community in which you're going to serve, but it's that needs to be developed. And I'm just reflecting on a conversation that I once had recently with the head of medical and dental training across England, and actually dental care professionals fell into her portfolio as well, only because nobody else wanted them. It's quite interesting when you look at the challenges. And she actually said to a very eminent audience that we're recruiting the wrong people. That actually we need to think not just about people with strong A levels. For the training of doctors and dentists, there is a need to have A levels, but most of you that work with dentists who've been qualified more than 25 years have probably got B's and C's, and they were really good practitioners because they were at those stages, depending on where you went to dental school. In some dental schools, it was genuinely, and I've no reason to disbelieve what I'm going to say now, you were a very good rugby player. But in that, you were part of something different. You could demonstrate an understanding. You had empathy. And certainly in terms of recruitment for dental hygienists and dental therapists, if you think until 2000, you had to be a dental nurse or had dental nurse experience because there was no definition of a dental nurse. And they really struggled and worked hard to get there. And it meant they were going to put much more into the profession on the outturn. So I think for the future, and part of my work now is around defining a dental hygienist apprenticeship, which we have. We just need the extra money to make it work, but it's on the statute, whereby people would receive a salary while they were in training. They will work in local centres. They won't work in a dental practice. But the recruitment would actually be aimed at dental nursing because they would still need to have a very good level of education to come on the programme. But it would provide much more local opportunities to people to serve their local communities. But in doing so, have a much more broader outlook and almost question, actually, if you have an A level, can you demonstrate empathy? And the evidence is that can be a bit of a question. When we talk about having 3-star A levels for entry into medical or dental training, it's very clear that empathy can be a challenge. And that is our challenge for the future. I think when we're recruiting the people for the future, because it's now when it begins, and for people when they're in training today, or for those of you listening who are newly qualified, to think and say, do you really want to be part of the profession? But the profession doesn't end at 5 o'clock. It's making sure that you take the time, you look at what the opportunities are to serve your peers and to provide that different level of understanding that you can't do in a 9-to-5 job. So in a nutshell, it's demonstrating, as you would have done every day when you were a student, that you care, you're empathetic, but you're willing to go the extra mile.
Absolutely. True engagement. Yeah. And with that comes more motivation, more enjoyment of the job. And it was interesting, Mike, when you said earlier on about the people who've helped you. I think we're both possibly at stages in our career where it's inherent and natural for us now to see that opportunity in younger people, and that's something we can do for the newly qualified, is when you spot those people with a keen eye or who are just naturally good authors, that actually we step out of our comfort zone and go and speak to them and try and encourage them. And that takes time. We're busy people. Reading somebody's article, it takes time, and giving them feedback in a sort of useful way. But actually it's about us giving back as well, isn't it, in that way? That's really interesting. Thank you. Mike, thank you so much for joining us and for sharing your reflections on such a well-deserved honour. It is. It's inspiring to hear how your work has shaped and supported our profession over many, many years. Won't say how many. And I'm thinking, if today's conversation has been, for the listeners, if today's conversation has made them think a little bit differently about what awards are about, and as you said, supported awards, these standalone awards where we can really appreciate our colleagues, you can look at possibly considering nominating someone for the next Dr. Gerald Leatherman Award. You can submit that via the website. So if you go to the BSDHT website and just type in the search function, the Dr. Gerald Leatherman Award, and you can help us to continue celebrating those people who really do go above and beyond for our profession. Thank you very much.
It's been a pleasure. Thank you.
Hello, it's Simone Rosario from the BSDHT. This episode's member question has asked, I'm inquiring about LA dental exemptions for dental hygienists. They have completed the course by NHS England, and they wanted to check if this course was acceptable for training as dental hygienists within private practice. They presumed it was, but they wanted to check because it was provided by the NHS. Our response was, we're delighted that you completed the free exemptions course provided with the NHS and that you are able to practice within both NHS and private practice. We also suggested that as a form of good practice, that within your dental clinic, that you would implement a form of practice policy that states that this is the case, that you would have on file that you have completed the training. We've also suggested that this policy is renewed annually.
That brings us to the end of today's episode of Dental Health Matters. Thank you so much for listening. I hope you found today's conversation helpful and informative. If you enjoyed this episode, please remember to subscribe, leave a review, or share it with someone who you know might benefit. See you next time.